Including skin cancers, colorectal cancer is the third most common cancer diagnosed in both men and women in the United States. OSF HealthCare piloted and put in use an FDA-approved software platform with integrated AI algorithms to help physicians get a better look during a colonoscopy, bringing cutting-edge care to patients.
What we're learning now about the gut microbiome is so fascinating in that we used to think it was reactionary to your brain. Now we're learning that your gut microbiome may actually, in fact, influence your brain such that it may affect your appetite, your mood, your sleep, your athletic performance. All four of those things have been directly implicated in a healthy gut microbiome and better quality of life.
That's Dr. Omar Khokhar, gastroenterologist for OSF HealthCare, and I'm Shelli Dankoff, your host for OSF HealthCare Accelerated. We appreciate you tuning in and remind you to be sure to subscribe, rate, and review wherever you get your podcast. Colorectal cancer remains one of the most common cancers. The American Cancer Society estimates more than 154,000 people in the United States will be diagnosed with colon and rectal cancer in 2025. Nearly 53,000 will die from the disease this year. On the plus side, the number of people who have died from colorectal cancer has steadily decreased since the mid-1980s due to increased screening and changing lifestyles. OSF HealthCare St. Joseph Medical Center in Bloomington, Illinois, helped pilot new artificial intelligence-backed colonoscopies to improve detection of precancerous polyps, technology that's spreading across the OSF ministry. Dr. Omar Khokhar, gastroenterologist at OSF St. Joseph, was a leader in implementing its use. He joins us to talk about GI Genius and how it's helping keep rears in the clear. Before we get to a discussion about GI Genius, what about gastroenterology drew you to the specialty, Dr. Khokhar?
I'd like to come up with something pithy and innovative, but I think the true answer is close to home. My dad is a gastroenterologist, and so I really grew up with it. My first mouse pad as a kid, as a 9-year-old, was the shape of a liver with a drug company on it. I had mugs with acid suppression drugs and pens everywhere. So that was back in the day. So that was my first early exposure to gastroenterology. And I thought about some other specialties, but ultimately I like the combination of cognition and hands-on. It's almost a borderline surgical procedure, which I like.
Okay, so what territory of the body does gastroenterology cover? Just for people, just to give them that reference point, because it's a pretty sizable area, isn't it?
It is. So gastroenterology starts at the mouth, ends in the anus. So it's the entire digestive tract in between. That's your esophagus, stomach, small intestine, large intestine, and rectum. But then you have 3 accessory organs that also come under gastroenterology. Those are the liver, gallbladder, and pancreas. And so those also contribute and play a key role in digestion. And so any kind of pathology or disease state in those also comes under gastroenterology.
Okay, let's turn our attention to GI Genius. What is it and what is it designed to do?
So GI Genius is a technology that arose about 3 years ago. And what it is that it's a graphical interface looking at our screen when we do a colonoscopy. So the purpose of a colonoscopy is to get to the end of the colon. And then as we withdraw the camera, we are looking at the folds and the surface of the colon to look for any disruptions in the surface integrity that could be a polyp or any other kind of lesion that could potentially lead to precancerous lesion leading to cancer. And so until recently, we've had to rely on our eyes to look for those abnormalities. And so what the GI Genius overlay does is that it uses artificial intelligence to also look at any potential imperfections or abnormalities that otherwise may not be caught.
Okay, full transparency. In 2024, you did my most recent colonoscopy using GI Genius when we were still just in the pilot phase at OSF HealthCare. I have family history, so I am all for keeping an eye on things early and catching things early. So from my perspective, the prep was the same, starting the procedure was the same. Honestly, it was really no different. But from your perspective, what was different about it?
From my point of view, I had not just my two eyeballs looking at your colon, but a billion different eyeballs looking at your colon. And so the way I compare it is I can look when I'm driving at the lane markers on the road, but over the last 20 years, our vehicles also do that. They can help lane assist or whatever you call. And so it's just another set of, say, 32 sensors around the car that can help keep that car within the lane. And that's what GI Genius does. It helps look more effectively.
So, is there an added layer of confirmation in what you're seeing? Is that the big benefit of this tool? I mean, you're right. You have your eyeballs. You've been doing this a long time. You're good at what you do. Does this just add that extra layer of confirmation to what you're seeing? Because you did find a couple of polyps on my colonoscopy. You took them out, and you may have done that anyway without it. But did GI Genius just kind of help you confirm? It's like, oh yeah, I'm not going to mess around with those. Let's take them out.
I think the current state is that it will highlight some kind of imperfection. Then it's up to me as the surgeon gastroenterologist to look at it more closely and say, hey, actually, that's just mucus. Oh, that's just poop. I wash it off, and then the GI Genius doesn't see it anymore. But if there's something persisting there, then I take a closer look at it. I can use my lenses on my scope to look at it a little bit differently, and then I can decide, do I biopsy that? Do I remove it in its entirety? I obviously retain the autonomy and decision making on what to do with what the GI Genius sees.
Okay, some people may hear the words artificial intelligence and think robots are inside or something is being implanted. It's far from that, correct?
It's simply a graphic overlay to the screen that I'm using. That's it. There's nothing inside your body. There's nothing being deployed. It's not like the Matrix where they drop a little bug into your stomach. We're not doing anything like that. From my point of view, it's just another graphic overlay of the screen that I see with my scope.
Okay, I saw some rather scary stats. I want to go through these. 1 in 24 will be diagnosed with colorectal cancer in their lifetime. While 66 is the average age of diagnosis among men and women, about 10% of colon cancer cases are diagnosed in people younger than 50, and those numbers are rising each year. But colorectal cancer is highly treatable if caught early. Do you see GI Genius potentially being a game changer for all of those numbers?
I think it will contribute to the ones getting colonoscopy. What I think is going to be much more game changing to what you asked is the better refinement of non-invasive screening tests such as stool-based testing and I think soon to come blood-based testing. Those are inherently much less invasive, and if we can convince a 30 or 35-year-old to go and get a blood test or a stool sample, that's a much simpler lift than asking them to come in for a colonoscopy.
Yeah, do the numbers concern you when you start hearing about the number of people younger than 50 who are being diagnosed with colorectal cancer? Is that of concern to you?
Oh, it's massive. I mean, with the way we consume our food and we think it's multifactorial, but I think you can really draw a pretty straight line between the higher incidence and then ultra processed food ingestion and microplastic ingestion. We're just taking things into our body that our body doesn't know what to do with. And when we don't know how to metabolize it or absorb it or digest it, it just kind of goes into a cubby and then it may be inert and nothing happens to it, or it could trigger off a reaction leading to malignancy.
So, final words when it comes to GI Genius, colonoscopies, anything gastroenterology related. Final words.
I think just, be aware of what you're putting into your mouth. Clean eating means a clean GI tract, means a happy GI tract. What we're learning now about the gut microbiome is so fascinating in that we used to think it was reactionary to your brain. Now we're learning that your gut microbiome may actually, in fact, influence your brain such that it may affect your appetite, your mood, your sleep, your athletic performance. All four of those things have been directly implicated in a healthy gut microbiome and better quality of life.
Dr. Omar Khokhar, thank you for taking time out and joining us for this gut check, if you will.
Always a pleasure, Shelli. Thank you.
And thank you for joining us as well. And remember, you can find all OSF Healthcare Accelerated podcasts online at osfhealthcare.org/accelerated.